on the first exam on the grading system, right? Likewise, there's going to be a question on dermatomes on the first exam. So you need to know the grading system, 5, 4, 3, 2, 1, 0. Just as many people use the lettering system. Normal, good, fair, poor, trace, 0. So we're going to start with the ankle first. So I want you to take your shoe off, please. And why would, you can leave your sock. You can, oh, that's right, you can take it off since you got it off.
Okay.
So why did I ask her to take her shoe off if we're doing a manual muscle test? Right, it's a weight, right, on her leg. So we're going to eliminate the weight. So if I don't know how strong someone is, I'm going to see if they can get a score of 3. F, fair. That means they can go through the full available range of motion against gravity. Okay? So keep your knee still and just raise your foot toward the ceiling. Now, keep your knee still, just raise your foot toward the ceiling, as far as you can go. Okay? So she's going through her full available range of motion against gravity. She gets a 3. I'm now going to apply the brake test. B-R-E-A-K, not brake on a car. So I stabilize her lower leg, put my, so dorsiflex your foot. I'm going to try to push your foot down, don't let me. So put my hand on top of her foot, and I'm slowly going to apply force. I'm not going to just jerk her hand down. So I'm going to push, and I'm going to use the amount of force based on the age, size, sex, body build of the patient. So I'm assuming she's pretty strong, okay? So I'm going to eventually give a pretty good amount of force. If she was 90 years old, I'm not going to push as much as I would if she's 20, 21. Everybody agree how that kind of makes sense? So bring your foot up. She gets a 3. I'm going to push your foot down. Don't let me. And I push as hard as I can. She gets a 5. Normal. If she takes some resistance but then gives way, that's how we're going to pretend on the lab exam. It's a 4. If she can bring it up but take no resistance, again, that's a 3. If she can't bring it up, I have to put her in a gravity eliminated position. So you got to slide all the way up on the table, lay on your side, this side down. And you got to go all the way up. Okay, so now put your foot in plantar flexion, and now see if you can dorsiflex. So now with gravity eliminated, she gets a 2. Everybody agree? So for every point in the range of motion, from let's say elbow flexion, as the muscle length changes, the amount of force the muscle can develop changes. So if I were to try to do a manual muscle test, in what this range from 0 to like 140, where am I strongest, do you think? So you stand up and put your arm in what you think is the strongest position. You can generate the most force. Okay, so that's what she thinks. I think I could do more at about 90, but it changes. Down here, I'm not very strong. And up here, I'm not very strong, relatively speaking. Everybody kind of see what I'm trying to say? So if she can't do it here, I'm going to put her into the more powerful range, and now dorsiflex, and now she gets a 2. Now, if she still can't move it, no matter where I put her, I feel the anterior compartment, so just tighten up these muscles a little bit. I feel tension, but not enough to cause motion. That's a 1, trace. Everybody good? Okay, so they can sit off the edge again, please. So the next, we're going to test, so in the lab exam, we're going to test the dorsiflexors and plantar flexors. In real life, you would test the inverters and everters, but on the lab exam, we're only going to do 2, because of the knee, we only do 2, knee extension, knee flexion. So now I'm going to do the plantar flexors. So now point your foot toward the floor. Is that a 3? What's the definition of 3, people?
Do it on your own.
Against gravity. What's helping her plantar flexor foot?
Gravity.
Gravity. You have to lay on your stomach. And flex your knee to 90. Now point your foot to the ceiling. That's a 3. She's done it against gravity. Everybody agree? Okay, so now I'm going to apply the brake. So stay there. Bring up to 90. Point your foot to the ceiling. I'm going to try to push your foot back down. Don't let me. and I can't budge her, she gets a 5. She gets a little bit of resistance, but then she gives way, that's a 4. If she can get it up but take no resistance, that's a 3. So now you got to lay on your side and side down again, please. And now you put her in dorsiflexion and see if now can you plantar flex. That's a 2. Okay? She still can't move it, but I feel her calf, so tighten up your gastroc. I feel tension, not enough to produce movement. That's a 1. Everybody good? Okay, now we'll do the hamstring. So you gotta lay on your stomach. Now flex your knee to 90 degrees. Okay, that's the test position. Now go as far as you can. What's helping her do that? Gravity, right? That's why you stop at 90 degrees. So come back to 90. I'm gonna try to push your foot, pull your leg back down to the table, don't let me. So again, let her develop the tension. Let her feel your hand there and know what you're gonna do, and then you push as hard as you can appropriately. She gets a 5 or a 4. And then you gotta lay on your side, the side down again. And now you put her in this extended position, now try to flex your knee. Now she gets a 2. She can do it with gravity eliminated. She can't move it at all, but I feel the hamstrings, I feel tension, that's a 1. And now sit off the edge again. So next, we're gonna do the quads. So fully extend your knee. So she gets a 3, full range of motion against gravity. But to apply the brake test, and when we talk about the knee in a couple weeks, as the knee extends, the tibia also externally rotates. That's called the screw home mechanism. The condyles of the tibia, condyles of the femur are not perfectly symmetrical, so when they extend, they lock, and you're more stable in terminal extension. So she has some bony stability in this position. So I want to eliminate that and I just want to test the quads. So at 30 degrees of flexion, the screw home mechanism is eliminated, and you can then isolate the quads. So she comes to 30 degrees. Now the screw home mechanism is eliminated. I'm going to try to push your leg down. Don't let me. And so she takes maximum strength. She gets a 5. Some resistance, then gives way. She's probably going to say that hurts. I say where? She says her quad muscle. Okay? She can straighten it out, but no resistance, 3. If she can't bring it up at all, you can say, go, lay on your side again. And now she starts in a flex position, and now see if you can extend. Now she gets a 2. Can't move it no matter what position I put her in. I feel the quad muscle. I feel some tension, but not enough to cause movement. That's a 1. Okay? So now we're going to do the shoulder. Now this is a study done at Duke University. And the purpose of this test, this study, was to determine the optimal position for the rotator cuff muscles to work at their maximum efficiency or strength. And so they stuck EMG electrodes into all the muscles of the shoulder complex and did these manual muscle tests. And they found at these different positions, the particular rotator cuff muscles had the maximum force. Okay? So the top on the left is supraspinatus. So when we talk about the shoulder, we're going to talk about this in great detail, the origin, insertion, action, etc. But supraspinatus comes from the supraspinous fossa under the acromion, attaches to the greater tuberosity of the humerus. It's an abductor, but in actuality, as the arm comes up, it keeps the humeral head centered in the glenoid, so the humeral head doesn't ride up, but we'll talk about that later. So, in the old days, before the first EMG studies, I would have the person bring their arm up to 90 degrees, and then we'd apply the brake test, push their arm down. But mainly, what muscle was I testing?
Deltoid.
Deltoid, right? And very little supraspinatus. So it wasn't a very effective test for supraspinatus. But that's why we used to do it. Then the first EMG study was done in the early 60s by a guy by the name of Frank Jobe, J-O-B-E, famous sports medicine orthopedic surgeon. He was the team physician for the Dodgers and the Rams when the Rams were in Los Angeles. Now they're back in Los Angeles. But that was in the era of Sandy Koufax, Don Drysdale, Hall of Fame pitchers. So he did this study, and he found the optimal position wasn't 90 degrees, but it was 90 degrees of abduction, 30 degrees of horizontal adduction, and just as many people call that what?
Flexion.
Horizontal flexion. So which term do I think you should need to know?
Both.
Both, because somebody's going to do one term and somebody else is going to use the other term. So you need to know both so that you can communicate. And then he did thumb down, which he called the empty can position. Now, I realize you guys won't understand this, but in the 60s, when college kids used to chug a beer to show that they drank the whole thing, they would turn the can upside down. I know that's stupid. You would never think of doing that. But that's what they did. Empty can position. And so for many years, that's how I taught the test. The Duke people came along and said it was a slightly different position. So now they say 90 degrees of flexion, 45 degrees of horizontal abduction, or horizontal extension. Thumb up, full can position. So 90 degrees, 45 degrees, full can, thumb up. I'm now going to push the arm down, don't let me. And she can take maximum resistance, that's a 5. Takes a little bit of resistance, gives way, that's a 4. If she can hold it there but no resistance, that's a 3. To get a 2, so you just have to lay on your back and put your arm at your side and slide your arm out to the side. That's a 2. Gravity's been eliminated. Okay, you can't get a 1 because you can't palpate supraspinatus directly. It's covered by the trapezius, covered by the deltoid muscle. Everybody good? So I'm going to ask you that on a test. I've asked that, what's the test position? Okay. Next is going to be subscapularis. Subscapularis comes from the subscapular fossa, anterior surface of the scapula, comes through the axial armpit to the lesser tuberosity of the humerus. It's a medial rotator. So that motion is pretty strong versus going out, because there's lots of muscles that do that. But if you can imagine my arm passing through my body, and now it's in small of my back, and going like that, that still is subscapularis working. So everybody do that. Put your hand in the small of your back. Try to lift it off the back. You all can do that, but are you very strong in doing that? No, because only one muscle is doing it, subscapularis. All the other muscles here in the front are in a mechanical disadvantage. So now you got to stand up, please. And so maybe turn sideways, put hand in the small of your back, and now, so this is technically not a true manual muscle test, because she's not doing it against gravity. But lift your hand over the small of your back. So I'm calling that a 3. Now I'm going to apply the brake test. I'm going to try to push your arm back into your low back. Don't let me. So let her feel my tension, and then I push, and I think that's pretty good. That's a 5. Now, if I wanted to, I could just do that, because she's not very strong, but I'm not going to be stupid and do that, okay? Everybody good? Subscapularis. Now, if you had to do it against gravity in a true manual muscle test, so now you got to lay on your back again. I won't pick on you the rest of the semester. So, subscapularis, medial rotator. This is medial rotation. Everybody agree? Okay, so I'm going to abduct her arm to 90 degrees. This is medial rotation. Everybody agree? So come up to 90. And so why didn't I have her come all the way through? Gravity, right? So she stops there. I'm going to try to push her arm back. Don't let me. And she knows exactly what to contract. She gets a 5. Okay? If she gives a little bit of resistance, gives way, that's a 4. To get a 2, you can sit up here, almost done. To get a 2, you'd ask the person to lean over, externally rotate their arm, and internally rotate their arm. That's a 2. Okay? Now, the last one is infraspinatus, but for some reason the Duke people left out the word muscle teres minor. So you should add teres minor to that list. So this position, those two muscles are external rotators. So the best position was, I should come forward just a little bit more. is to go, if this is 0, 45 degrees internally rotated. Now I'm going to try to push her arm in, don't let me. And she's contracting these two external rotators, infraspinatus and teres minor. If she can't do that, you lean over, start with your arm internally rotated, and see if you can externally rotate. And that's a 2. Trace, you can feel infraspinatus and teres minor. Feel tension. Everybody good? You're done.